As we navigate the golden years, it's easy to sometimes dismiss changes in our bodies as just getting old. However, ignoring certain warning signs can have devastating consequences. Today, we're going to discuss 7 critical physical symptoms that should never, under any circumstances, be overlooked. These are the red flags that medical experts insist require immediate hospital care. No waiting, no hesitation. This isn't about instilling fear, it's about equipping you with the knowledge to protect yourself and your loved ones. A concerning number of older adults delay seeking medical attention, often assuming that their symptoms are insignificant or simply not wanting to inconvenience anyone. However, in numerous instances, prompt action can prevent a minor issue from escalating into a major health crisis. More importantly, being aware of these warning signs empowers you to take control of your health. In this video, you'll learn about 7 specific warning signs that doctors emphasize you must never overlook. These aren't vague or general symptoms. They are very specific, very real, and often time-sensitive. Stay with us until the end, because understanding just one of these signs could potentially save your life or the life of someone you care about. Let's get started. Sign 1. Slurred speech or facial drooping. There's a very specific set of symptoms that doctors and nurses are trained to recognize instantly, and they point to a medical emergency that simply cannot wait. Stroke. If you suddenly experience difficulty speaking, find that your words are garbled or slurred, or notice that one side of your face isn't moving in sync with the other, perhaps a drooping eyelid or a crooked smile, you need to get to the hospital immediately. The same urgency applies if you find yourself unable to lift one arm, or if it drifts downward uncontrollably when you attempt to raise it. These aren't signs to rest off or wait and see. They are clear indications that your brain may be in serious trouble. A neurologist once said, "Every minute a stroke goes untreated, you lose nearly 2 million brain cells." Think about that. Time isn't just money, it's memory, speech, movement, and life itself. This is a hard fact, and one that many people don't fully grasp. In seniors, strokes can sometimes happen without any obvious warning signs. You could be having a perfectly normal day, reading the newspaper, watching television, enjoying lunch, when suddenly the words you're trying to say don't come out the way you intend, or your smile becomes noticeably uneven. These subtle changes might feel strange, but not necessarily frightening, and that's what makes them so dangerous. When it comes to stroke, the sooner you receive treatment, the greater your chance of recovery. Clot-busting drugs like TPA, tissue plasminogen activator, are most effective within the first few hours after symptoms begin. After that window, the chances of reversing the damage significantly decrease. Let's consider the case of Robert, a 68-year-old Vietnam veteran. One morning, while having coffee, he inexplicably dropped the cup from his right hand and couldn't understand why. He called out to his wife, but the words didn't sound right. She immediately noticed his face, saw that his smile was crooked, and called 911 without hesitation. Robert received treatment within an hour and made a remarkable recovery. "If she hadn't acted so fast," he shared later, "I might be in a wheelchair or worse." The medical community uses the acronym FAST, Face, Arms, Speech, Time, to teach people how to recognize a stroke. But the part that many people forget is the last letter, T, for time. This means that every single minute counts. If there's slurred speech, facial asymmetry, or sudden arm weakness, don't take a nap hoping it will pass. Don't wait for a doctor's appointment next week. Call emergency services immediately and get help. Because when your brain is in trouble, acting fast could save your ability to walk, talk, remember, and live independently. It could save your life. Don't delay. Sign 2. Sudden chest tightness or pain. One of the most urgent signals your body can send is a sudden, unexplained pain or pressure in your chest. It might feel like a tightness, a squeezing, or even a burning sensation, and it can radiate to your arms, shoulders, neck, or jaw. While some people try to convince themselves that it's just heartburn or anxiety, the reality is that this could be your heart crying out for help. And in older adults, this is especially dangerous because the signs of a heart attack can be subtle, slow to develop, or completely unlike what you might expect. A cardiologist once shared the number of patients who arrived too late because they thought it was just indigestion. It's heartbreaking. If there's even a chance it's cardiac-related, get checked immediately. That statement holds a lot of truth, especially when you consider that many heart attacks in seniors don't come with the crushing, dramatic pain we see on television. Sometimes it's a dull ache, a fluttering feeling, or just a nagging sense that something isn't quite right. You might also feel dizzy, short of breath, or suddenly exhausted, even without any physical activity. These aren't things to monitor and see if they get better on their own. They are things to act on immediately. Consider the case of Helen, a 74-year-old retired school teacher. One afternoon, while reading a book, she felt a strange tightness in her chest. It wasn't excruciating, but it lingered. "I thought maybe it was gas," she said, "but something told me to call my daughter." Her daughter rushed over and insisted they go to the hospital. It turned out that Helen had suffered a mild heart attack. Thankfully, she was treated quickly and made a full recovery. "If I had waited," she said, "I might not be here now. Now, I listened to my body the first time." That's the lesson here. When your body is in distress, it doesn't always scream. It often whispers. And with something as serious as heart trouble, those whispers can be a final warning. The symptoms can also vary based on gender. Women are more likely to experience nausea, vomiting, and back or jaw pain during a heart attack than men. It's crucial to be aware of these differences. Don't wait until you're on the floor or can't breathe. If you experience chest discomfort that's unfamiliar, persistent, or accompanied by other symptoms, go. Don't wonder, don't wait, just go. It's better to be safe than sorry. Mid-roll engagement. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I highly recommend you do so and turn on the notification bell so you don't miss any future videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Sign 3. Shortness of breath without exertion. There's a vast difference between catching your breath after climbing a flight of stairs and feeling like you simply can't breathe while you're sitting still. If you find yourself gasping for air during a quiet moment, reading on the couch, watching television, or even lying in bed, it's absolutely not something to brush off. Sudden shortness of breath without any real physical activity can be a red flag for serious conditions like heart failure, pneumonia, or even a pulmonary embolism, which is a blood clot in the lungs. All of these require urgent medical attention. A respiratory specialist once said, If breathing becomes difficult for no clear reason, that's your body raising an alarm. It's not just age or fatigue, it's a cry for help. That statement rings especially true for older adults. As we age, our lung capacity naturally decreases, and our heart works harder to pump oxygen-rich blood throughout the body. But what separates a normal sign of aging from a medical emergency is how suddenly it appears and how severe it becomes. If you're breathing hard after simply walking across the room, or if you wake up feeling like you can't catch your breath, something is very wrong. It might be your lungs, your heart, or both, and waiting could mean worsening symptoms or irreversible damage. Ignoring this sign could also delay the diagnosis of conditions like asthma or COPD, chronic obstructive pulmonary disease, which can be managed effectively with early intervention. Let's take the example of Walter, a 76-year-old retired electrician. He'd always been in decent shape, but one evening, while watching his favorite show, he felt like he couldn't get enough air. There was no chest pain, no fever, no recent activity, just this overwhelming sense of breathlessness. His daughter convinced him to go to the hospital, where they found a small blood clot in his lung. "If I had waited until morning," Walter said, "I might not have woken up." That's the lesson to take away. Shortness of breath isn't something to monitor later, it's something to act on now, especially when it comes on suddenly, worsens quickly, or makes even simple tasks feel like a strenuous workout. Trust your body. It knows when something is off, even if you're not quite sure what it is yet. If breathing becomes difficult for no obvious reason, go straight to the emergency room. It's far better to find out it was nothing than to discover too late that it was everything. Sign 4. Unusual confusion or sudden disorientation. When a senior becomes suddenly confused, forgets familiar things, or appears disoriented about where they are or what time it is, it's easy to blame it on just getting older. But that kind of mental fog that appears quickly, especially if it's completely out of character, is one of the most serious warning signs there is. It could point to a stroke, a brain infection, dangerously low oxygen levels, a severe reaction to medication, or even a urinary tract infection, UTI, which can cause delirium in older adults. Each one of those possibilities requires immediate medical attention. A hospitalist once shared, "In older adults, the brain is often the first organ to signal trouble. Sudden confusion is the body's emergency light flashing." That observation is especially important because many seniors and their families may not recognize confusion as an emergency. They might assume it's just tiredness or a bad day. But when the change is sudden, like forgetting names, getting lost in familiar places, or speaking in ways that don't make sense, it's time to take it seriously. These aren't gradual memory changes. They're abrupt shifts that often signal something much deeper. Consider the story of Linda, an 80-year-old woman who lived independently and managed her own affairs. One morning, her neighbor found her standing in the hallway of their building, unsure of how she got there or why she was there. She was fully dressed, but seemed startled, and kept repeating the same question over and over. Her family initially thought it might be dehydration or fatigue, but when they brought her to the hospital, she was diagnosed with a urinary tract infection that had triggered a sudden onset of delirium. She received antibiotics and fluids and returned to her normal self within a few days. "I didn't know confusion could come from something like that," her daughter said. "Now, I'll never ignore it." That's exactly the kind of outcome we hope for. The brain is incredibly sensitive, and in seniors, it often responds to other problems. like infection, lack of oxygen, electrolyte imbalances, or even blood sugar changes, before anything else does. So, when confusion strikes out of the blue, don't wait for it to clear up on its own. It might, but if it doesn't, or if it worsens, the consequences can be irreversible. Prompt treatment can also help prevent long-term cognitive decline associated with delirium. Don't delay, seek help immediately. Mid-roll engagement. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I highly recommend you do so and turn on the notification bell so you don't miss any future videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Sign 5. Severe or sudden abdominal pain. We all experience aches and pains from time to time, especially as we get older. But when that pain is sharp, sudden, or feels like it's getting worse by the minute, particularly in the abdominal area, it's absolutely not something to ignore or wait out. Severe belly pain can signal a medical emergency such as appendicitis, a perforated ulcer, pancreatitis, diverticulitis, or even internal bleeding. These conditions require prompt diagnosis and treatment to prevent life-threatening complications. In older adults, abdominal pain can also point to a blocked intestine, bowel obstruction, or a ruptured organ, both of which can be life-threatening if not treated right away. The risks are even higher if the person has underlying conditions like heart disease or diabetes. A trauma surgeon once explained, "When a senior complains of sudden abdominal pain, we take it very seriously, because time makes all the difference between a fixable problem and a fatal one." That perspective should stick with you, because for seniors, the risk of complications is higher, and the classic signs of illness don't always appear the same way. You might not even have a fever or visible swelling. You might just feel off, or you might double over in pain without warning. Either way, your body is telling you something, and you need to respond. Let me tell you about Frank, a 72-year-old widower who prided himself on being tough. One evening, while finishing dinner, he felt a stabbing pain in his lower abdomen. He assumed it was gas, took some antacids, and went to bed. By morning, the pain had spread, and he was too weak to stand. His daughter called an ambulance, and the ER team found a twisted section of his intestine that had cut off blood flow. Emergency surgery saved his life. "I thought it would pass," Frank later said. "I didn't realize how fast things can go downhill." That story isn't uncommon. Seniors often downplay pain or wait to see if it improves. But when the pain is sharp, persistent, or unlike anything you've felt before, it's not the time to tough it out. It's time to go in. You won't lose anything by being cautious, but you could lose everything by waiting too long. Remember to be specific when describing the pain to medical professionals, where it's located, what it feels like, sharp, dull, throbbing, and what makes it better or worse. This information can help them narrow down the possible causes more quickly. If you feel intense abdominal discomfort that doesn't go away, especially if it's accompanied by nausea, vomiting, or dizziness, don't guess. Don't Google it. Go. Sign 6. Persistent vomiting or vomiting blood. Throwing up once in a while, maybe from spoiled food or a stomach bug, is unpleasant but usually passes. But when vomiting continues for hours, or if there's blood mixed in with it, it stops being a simple nuisance and becomes a serious medical concern. Persistent vomiting can lead to severe dehydration, electrolyte imbalance, and even kidney issues. And vomiting blood, no matter how small the amount, may point to something much more dangerous, like bleeding in your stomach or esophagus, a torn esophagus, or ulcers that have ruptured. A gastrointestinal specialist once said, "Blood in vomit is never normal. It's one of the fastest ways we identify internal bleeding in older adults." That should stop anyone in their tracks, especially because some people shrug it off or misidentify it. The blood may appear bright red, or it may look like coffee grounds, dark, grainy, and unexpected. Either way, it's a sign that something is going wrong inside your digestive tract. For seniors, this can be a reaction to medications like anti-inflammatories, NSAIDs, a complication of an undiagnosed condition like gastritis or liver disease, or even stress-related damage to the stomach lining. Consider the case of Evelyn, a 79-year-old woman who had been taking over-the-counter pain relievers for her arthritis. One night, she started vomiting after dinner. At first, she blamed the shrimp, but when she saw dark flecks in the sink, what she initially thought was old food, her grandson insisted on calling for help. At the hospital, doctors confirmed she had a bleeding ulcer that had been quietly growing for months. "I had no idea it was that serious," she admitted, "but if I hadn't gone in, I might not have lasted another day." This is a warning that can't be overstated. Vomiting blood is not something that waits until morning. It's not something to sleep off or to fix with ginger ale. It means something in your body is broken and it's leaking into places it shouldn't. Whether it's a damaged stomach, liver complications, or a burst blood vessel, only immediate medical care can determine the source and stop it in time. In addition to seeking immediate medical attention, it's crucial to stay hydrated by sipping clear fluids if possible, and to avoid taking any further medications until evaluated by a doctor. Sign 7. High fever with stiff neck and sensitivity to light. When you have a fever, it's usually a sign that your body is fighting something off, a cold, the flu, or some other infection. But if that fever is high, above 102 degrees Fahrenheit or 39 degrees Celsius, and comes with a stiff neck, severe headache, confusion, or extreme sensitivity to bright lights, it may be a sign of meningitis. Meningitis is a life-threatening inflammation of the protective layers, meninges, surrounding your brain and spinal cord. While meningitis is more common in younger people, it can absolutely affect older adults, especially those with weakened immune systems or other ongoing health issues. And when it does, it can move fast, too fast to ignore. An emergency physician once said, "If an older adult comes in with fever and can't bend their neck or handle the light, we drop everything." That's how urgent it is. That kind of urgency speaks volumes, because by the time these symptoms appear, the infection may already be in full swing. Meningitis can be caused by bacteria, viruses, or fungi, and bacterial meningitis is particularly dangerous and requires immediate antibiotic treatment. The stiffness in the neck isn't just discomfort. It's your body telling you that the lining around your brain is inflamed. And the light sensitivity isn't just annoying. It's a signal that your central nervous system is under attack. For some, it also comes with nausea, vomiting, or a feeling like your head is going to explode from pressure. And none of this should ever be dismissed as just a bug. Consider the story of Jerry, a 75-year-old widower and avid crossword puzzler. One morning, he couldn't finish his daily puzzle because of a pounding headache. By afternoon, his neck hurt so much he couldn't look down, and the light from his kitchen window felt unbearable. Thankfully, His neighbor, a retired nurse, recognized the signs and drove him straight to the hospital. Doctors confirmed bacterial meningitis, and thanks to fast intervention, Jerry survived. "I thought I was just run down," he later said. "I had no idea it could be something so serious." That's the reality. When your body sends out warning flares like this, fever, stiff neck, light sensitivity, it's not overreacting, and neither should you. These signs strongly suggest that something is attacking your nervous system, and with meningitis, every hour counts. In addition to seeking immediate medical care, it's important to avoid close contact with others, as some forms of meningitis can be contagious. Treatment is available, and it works best when it's started early. So, don't hesitate. If you or someone you love shows these symptoms, don't wait for an appointment or try to sleep it off. Go to the emergency room and let the professionals take it from there. You'll never regret playing it safe with your health, but waiting might be a risk you can't afford to take. Conclusion. So there you have it, 7 critical physical symptoms that should never be ignored, especially as we age. It's essential to remember that these are just a few of the many potential warning signs your body can send. Being proactive about your health also includes regular checkups with your doctor, staying up to date on vaccinations, and maintaining a healthy lifestyle. These 7 signs aren't meant to frighten you. They're meant to empower you, because knowing when to take action is strength and weakness. It's wisdom. And wisdom, especially the kind that comes from years of living, means understanding that your health deserves urgency, not delay. It's about recognizing changes in your body and advocating for yourself. It's easy to brush things off, to say, "I'll be fine," or "it's probably nothing." But in many of the stories we shared today, people were only saved because they chose to act, because someone recognized the sign, picked up the phone, or drove to the hospital. Those moments made all the difference. They are testaments to the power of awareness and quick action. And remember, taking care of yourself isn't just for you. It's for your family, your friends, the people who care about you and need you around. Every day you stay safe and strong is a day they get to enjoy your wisdom, your stories, and your love. So, treat your health like the precious gift it is. Be vigilant, be informed, and be proactive. We'd love to hear from you. What's one thing you've learned from this discussion, and how do you plan to use it in your life? Your thoughts are important, so don't hesitate to share them. If you found this discussion helpful, please like, subscribe, and share. Your support helps us continue creating content that informs and inspires. Thanks for reading, and we look forward to connecting with you in the next video.